Okay, I'm going to give a brief overview of who we are, and we'll introduce ourselves as we go along through the presentation. We are a bit of a tag team like others before us today, but you're lucky that there are only 3 of us, because originally we were 8, so that would have taken quite some time. So good afternoon, my name is Wendy Weber from Pembrokeshire College, and for the past 6 and 7 months we have been working under the umbrella topic of maximising community resource use. I don't know whether you can see our presentation at all, because I can't see it on the screen, but I'll continue nevertheless. So our CEIC challenge group consists of 3 members. So we have Pembrokeshire County Council, Hywel Dda University Health Board, thank you very much, and Pembrokeshire College, with our primary focus on health and well-being. We know each other quite well, it's a small community, and we had actually begun conversations around this topic prior to joining CEIC, and we had identified common ground that we had, you know, a desire to work towards, which was quite simply how to work better together. So in a way, what we're doing is working backwards, in the sense that we had this common theme, and we had already agreed to employ an Academy Wales graduate for 18 months, 6 months between each of the member partners, in order to work on a social model of health that partners in Pembrokeshire are committed to delivering for the population of Pembrokeshire. And we realised that our challenge would have been way too big to complete without this graduate being in post. So we feel quite lucky, really, because our challenge is actually, how do we support communities to engage, collaborate and innovate for sustainable community redesign, basically to use our resources efficiently and effectively, with this focus on the health and well-being. So what CEIC has allowed us to do is to better understand how we as partners work, because as you can imagine, we are very different as organisations. So we understand what we do and who does it and how it's done, although I have to say there's still a very steep learning curve on this part of the journey. And what we've discovered along the way is that there are a lot of organisations working towards similar goals, even within our small community. And this has been our biggest challenge, I think, in that we have not yet actually agreed a finite list of stakeholders to work with. You can leave the slides there now. I'll stick with this one, and then Julian come in after me. Because there are so many working along the same lines, and CEIC came along at the most, you know, fortunate time to allow us to sit down and think how we needed to make this happen. So the role for us as a CEIC group, and ultimately our graduate, will be to integrate, collaborate and coordinate activity and resources across the public and third sectors, as you can see from our challenge, to support and develop community well-being, which is a huge task in itself. Being a rural community, it's very easy to operate in silos, very blissfully unaware what may be happening or could be happening in the next village or town to us, and that's something that we've discovered along our journey through this project. But what we are aiming to identify are the local assets to address the local need and to reduce and ultimately avoid the duplication of resources. Individual wellbeing is currently supported through GP practice-based multiple disciplinary teams, and our graduate will then review and access impacts of this work and share that best practice. So alongside this support for individuals, public and third sector partners are working together as multi-agency teams to look at intelligence sharing and collaboration. Because what we need to do is understand and communicate the strengths and weaknesses of a community's well-being, so that we can deliver actions in response to that. So the outcome of the work, we hope, at the end of the 18 months then, is to deliver sustainable processes for community engagement and co-production, community well-being assessments and produce action plans. So that's just a very brief overview. I'm now going to hand over to the second member of our tag team, who's Julian, who will explain all of this in a little bit more detail for you.
So hi, yes, I'm Julian Brewer, working with Pembrokeshire County Council within the commissioning team. If I can have the slide back up, please, that shows the previous one, the key aims of our challenge, just to Okay, I think there's one that was missing then. Is one after that the key aims of our challenge? No, okay, I'll go on to the next one then, that's fine. Yeah, so we've got some key aims, which was actually really trying to reduce a number of things, reduce carbon footprint, resource use, duplication, isolation, and the need of other services, and increase that shared resources, increase local and sustainable access, community connections, community cohesion, and well-being. So absolutely, we're saying this is a journey rather than a product that we'll end up with some of the things, some of the CEIC initiatives. People have looked at a video, a communications exercise, a product. They feel like you've got something tangible, but this is actually a way of working which will continue to evolve and develop and grow. Looking at some of the things we're trying to decrease on the left-hand side, I would certainly say traditional services, we've tended to focus on centralising things, reducing resources. Where we've rationed because there's not enough for everybody, we will sometimes turn people away if their need is not great enough and say, come back when it is. And you know what? They do. So often our offers are centered around a service, and we very happily refer people from one service to another, but we're trying to move towards increase that more local and joined up solutions, which empowers communities where resources really are not only shared and resources joined up, but are actually delivered within communities, for communities and by communities, with a much greater level of community not just engagement, actually ownership, I would say there. Early access, obviously, there's a great emphasis right the way through about things being preventative, but it's about moving from that rhetoric and the conversations and the know that that's that need to be preventative to how we actually deliver that effectively, economically, and practically on the ground. A lot of people will know that they want help when their situation is desperate. It's about actually helping people to get help before a situation is desperate, so that they can then avoid ever needing to be in that desperate situation. And then it's about centering things around a person, and while they're in a place for something, asking that question, while you're here, what about? Can we also? Is there another way in which we can help increase your health, your well-being, your community connection, any of those things? There's a lot going on. There is a lot already happening in this agenda, as Wendy's already referred to, and it's about embedding that as something that is not just happening in pockets, not just happening in pilots, not just happening in small initiatives, but is fundamentally the platform on which all of our services are developed and delivered. And along that journey, along that way, the resources required to deliver those services are reduced, they are localized, and therefore they are more effective. So I'm going to hand over to Ali, who's going to talk us through one idea that has already started within Pembrokeshire and that we're using to try and deliver these circular economy principles. Thank you.
Okay, so in Pembrokeshire, we were lucky the beginning of last year, 2021, that we were successful in obtaining some grant funding through Welsh Government for circular economy and developing circular economy initiatives and network within Pembrokeshire, which is called the Pembrokeshire Circle. Now, as part of that, we worked with Ella and also Ella from Benthyg and Phoebe from Repair Cafe Wales, who I may or may not be here today, and developed a library of things and repair cafes that are across the county. So I think we had 11 repair cafes where people can bring in items that they have that are broken, that could possibly be fixed, and also where people can donate items that are broken that could be fixed and then be used by others. So the repair cafes have been very popular, and we're seeing people across the county bringing in bikes, lawn mowers, all sorts, anything and everything, jewellery, things that need to be fixed. And all of these are sort of opportunities for conversations and for other activity that could perhaps centre around those individuals. Could we go back a couple of slides, please, if that's possible? To there we go. That's fine. That's perfect. So in terms of the repair cafes, those giving opportunities really for people to, obviously to stop things from going into landfill, to extend the life of products. The Library of Things is based in Haverfordwest, but all over the county, allows people to borrow things instead of buy, and there's lots of opportunities for us to develop this and to give more community ownership to the Library of Things. So we want to sort of develop that further. And one of the things that we really thought about in terms of well-being and health, and how we can improve the opportunities for us to support individuals, but to do so in a holistic way, is around bringing in more items to help people who may, for whatever reason, have a requirement for some assistive aids, rollers, walkers, wheelchairs and things like that, where they could get those things from the Library of Things, but how we can add on to that to include actual signposting to other organisations that would be able to support those individuals, having a presence at those events, community events and things. So there's lots of opportunities for around the Library of Things to get to know more what each community wants, and to respond to that by bringing those things in, making them available, but also bringing people and services in around the Library of Things to say, if people are requiring and needing these items, or they may also be requiring different support with their health, with their well-being, and I think there's room for that to grow, certainly with the growing cost of living and people's needs, to expand our sort of community connections through the Library of Things, and to add on services around those events happening within those communities. And the other aspect of that is the extension of the life of products. So we do also look at things that, so for example, metal filing cabinets that were coming in that could no longer be used, how we repurpose those perhaps into whole planters and things like that. So there's all sorts of opportunities that happen within the community as a result of the Library of Things and the repair cafes and the reuse and remanufacture, where we can get people involved proactively in the circular economy that improves their health and their well-being, through getting involved in some of the repurposing and answering the needs of the community.
I'm really sorry to interrupt. What you're saying is really interesting, and if you're able to stick around for the panel discussion, I'm sure there will be questions in the room. I don't know why I'm talking to you on the screen when you can see me down there. I'm sure everybody will have some questions for you, but just because we've got another group of speakers, I'm afraid I am going to have to say you've overrun on a topic that we love. But please do stick around for the panel discussion, and we'd love to hear a bit more in that slot. So thank you very much. Can we give them a clap?